All right, Doc.
Another good one here. Hi, we really appreciate Dr. Wren. I shouldn't be reading these, man.
No, it's nice that you read it.
I appreciate it. Well done for getting him on your channel. This is thanking you. So, but
well,
still,
I'm nothing without you, Doc. So it's a good teamwork.
I feel like doing the old, look down and kick my foot on the sand. Anyway, thanks. Has Dr. Wren heard of the practice of drawing both HCG and testosterone into the same syringe and injecting it one go? In one go, I guess.
He's English. Yeah.
I saw a Dr. Nelson Virgil, who was on TRT, do exactly that. He went on to say that the two substances won't mix in the syringe as one is water-based, HCG, and the other oil-based, so they will remain separated. He then used a small insulin needle and injected intramuscularly into his shoulder, optional. This way, those who use HCG and T multiple times a week can significantly reduce the amount of weekly HCG and T injections. Also, what does the doctor think of injecting intramuscular versus subcutaneously for HCG and testosterone? Big thanks from the UK, Kiri. So, first of all, Nelson Virgil, I love him. Good guy. Definitely has a great forum, Excel Mail, where a lot of these things can be bandied about, and you don't just hear from a doctor. You can hear from people that have done it through trial and error, which is great because we're not going to have a whole lot of studies like this sponsored by the AMA in this country, right? And again, I don't mean to be pejorative toward the AMA. It's just that's not their focus. So. In my opinion, as long as you don't extrapolate, meaning you don't say, okay, well, this went well, and then you extrapolate based upon what I call a made-up or gym science physiologic reason as to why it worked well, and say, okay, then we can apply that to this substance. That's where you get into trouble. But a lot of times in the gym, people will try something and go, wow, that combination worked out great. And as long as it's not harmful, we just learned something, right?
Right.
As far as mixing the two substances, in my opinion, you never want to mix an aqueous, a water-based substance with an oil-based substance. It has worked before, but just because it works 9 times doesn't mean it'll work the 10th time. What I find most often, because here's the thing people would do a lot. Instead of HCG, they say, well, let me throw a little bit of B12 in there when I do my once-a-week injection of T. That makes sense because both are, if you do 1 cc, 1,000 mics of B12, you're going to be above normal for the entire week until you do your next injection, most likely. But what I see happen every once in a while is your body will wall off that combination. I don't know why, but because you've got, oil and water, it just doesn't mix well. So oftentimes you can get a mouse, I call it, a lump there, which can lead to more and more problems. So, I'm not sure, I haven't talked to Nelson about this, and I'm not sure if I'm reading this properly as Nelson saying to go ahead and do that or not. But, my advice would be to separate the two. Now, you can make it easy if you're doing multiple injections by just what it looks like he is saying, which you can use an insulin needle to inject either intramuscularly, right? You can use an insulin needle that's 31 gauge, 5/16, and instead of putting it underneath the skin and leaving a little bleb, and if you're using a B complex, leaving like an orange stain underneath there for 24 to 48 hours, you can just throw it over here into your shoulder, into the muscle.
It works just as well.
Works just as well,
okay.
Or you could argue better. Because it's picking up the blood vessels and into the capillaries right away. But that's fine. As far as the intramuscular use of T, that's the preferred method in my experience. The sub-QT thing has been going around the block now for a couple of years.
I didn't even know you could do that.
We have some studies. We have some information, I'll leave it at that works well. I have patients that come in and say, hey doc, I started trying this. What do you think? and I ask them, well, what do you think? How's it working for you? The idea behind it is that you're going to have a slower absorption. For the same reason I just mentioned with HCG, because your fat is not as well vascularized. So you're going to have a slower absorption and fewer peaks and troughs throughout your period between injections,
so it's more
speak.
sustained release, sort of.
Well, yeah, and what I really mean is versus a once-a-week intramuscular injection where you're going to have a peak and a trough, right? Yeah. Which we all know about. But I use the example, okay, with men particularly, we're trying to maintain a 20-foot wall of water, if you will, and you inject, and I'm oversimplifying it, obviously, but then you have a 3-foot wave on top of that. Most people don't notice that, and while the numbers may change significantly, so it's really more like a 8 or 10-foot wall of water, you don't feel any different. Okay, and we can maintain your levels of the bad stuff, the excess estrogen, without having to worry about it. To me, the idea of throwing in a small amount of an esterified form of testosterone, which is, why do we have that? The time release factor and the benefit of only having to inject once a week is, pardon the expression, bass-ackwards. If you want to do something daily, well, then why don't you just do the cream?
Right.
Do it that way. The whole idea, to me, not the whole idea, but at least in the beginning, was to make for less frequent injection. We have undecanoate now, which leaves you even more time in between because it takes the body even longer to break up those bonds, right? So the sub-Q injection, I get it. You have fewer spikes along the way, and I'm not saying don't do it hey, it's all about whatever works for you. Yeah. And if you don't mind doing that every day and it's better for you than putting on a sticky cream, go for it. It's just, I have to address the theory behind it because a lot of people skip that part. Again, if it works better, that's a whole other thing we're talking about here.
Is it thick though to get that in that teeny tiny size?
Well, it's very difficult. I don't know anybody, I don't have the patience to try and pull it into a 31 gauge needle. I don't know, and I recommend using grapeseed oil in testosterone esters because it's a little less viscous than sesame or cottonseed. But I think you'd be there all day trying to pull it into 31. Now you could take a 1 cc syringe and attach a 20 gauge needle, pull in what you need, then remove it and put in you're going to be wasting a lot. But you could do it, and then boom, you throw it in, underneath the skin. The problems I have seen. Not across the board. Some people go, dude, this is great. I love it, doc. But every once in a while, I'll see somebody that gets a huge lump or more.
It's thick.
And almost, like with guys that use a lot of propionate, especially if it's bootleg and it's got, a baker's dozen of benzoate in it, you get flu-like symptoms. But even if it's straight from the pharmacy, that's the thing I tell people. You really want to use propionate? I try and dispel the whole gym science rumors about how it's going to hold less water and blah blah. Just means more injections, but you can get flu-like symptoms. People come in and they have I've seen them not only huge knots, but just short of having cellulitis, and we got to drain it out or we got to put them on antibiotics. Well, I'm not saying maybe they did it wrongly. Yeah, I don't know, but I don't think there's enough evidence there in terms of studies to suggest that it's the way to go. So I can't say, hey, I endorse it, but again, I'm not the end-all be-all. If guys are doing it and saying, hey, Rando, this works way better for me than the intramuscular injection, who am I to say it doesn't? I can't say, oh, well, you're going to harm yourself. The only thing I bring up is that I have seen some of those injections go awry. And again, more often than not, as in my clinical experience, I have seen people have a problem when they mix aqueous with oil base. But maybe that'll work differently. I can't imagine why it would subcutaneously. So I hope that's a good enough answer.
Yeah, his question was about HCG, correct?
Yes.
Yeah. What about GH? Just as a, is it also can you do it intramuscular? Does it work just as well, or is it better to do sub-Q?
I don't know of any studies that show using HGH intramuscularly act any differently.
Okay.
I would think it will work just the same.
Okay.
Because remember, the growth hormone is only in your system for 30 minutes before it converts to IGF-1, right?
Gotcha.
So what does it matter if it goes intramuscularly or subcutaneously? Now, with Samorelin, there's definitely a problem. With acetate, if you try if you try and do it anything other than subcutaneously, have you ever taken 1,000 milligrams of niacin after not taking it for a while? You know that flush you get?
Yeah.
Okay, it'll just about knock you on your butt. Okay, you definitely don't want to use Somorelin that way.
Okay.
Which is a growth hormone releasing hormone analog.
Right.
I know that with growth hormone intramuscularly, I've never heard of or seen that reaction take place. I think the main reason behind the protocol is that people in general don't like giving themselves needles.
Right.
Okay, and so the idea of just using a little teeny insulin needle and being able to put it underneath the skin is much more appealing.
Less invasive.
But in my opinion, my humble opinion, from what I've seen, most of the pain is mental. But whether you stick yourself with an intramuscular injection or subcutaneous injection, it's the needle passing through the skin that hurts. So whether you do it this way or this way, you're going through the skin, it hurts. Yeah. So, but there are some definite protocols you want to pay attention to. There are times when you don't have a choice and don't want to go intramuscular, only subcutaneous. And there's times you could do either one. With HCG, again, to answer the question, you can do intramuscular or subcutaneous. Doesn't matter.
Awesome.